Well, it's another pandemic milestone that we begin with tonight. Moderna and Pfizer vaccines can now be used to protect children 6 months and older from the ever-growing coronavirus. The first wave of vaccinations being shipped, even as we speak, to hospitals and health clinics across North Carolina. Good evening and welcome to the Fox 8 6 o'clock news. I'm Neil McNeil.
And I'm Jordan Brown. Close to 119,000 more doses of the vaccine have been pre-ordered by the state. 70,000 doses of Pfizer and 48,000 doses of Moderna. There are around 24 agencies in the triad who are a part of this first wave of deliveries. This is a look at the state's website where you can go to find a location near you. And this is where you can go. As I said, we do know Atrium Health Wake Forest Baptist will begin administering vaccines tomorrow morning in downtown Winston-Salem. And that's where we find Fox 8's Daniel Pierce. Daniel, this is expected to be a large rush or a smaller wave.
Yeah, this right here is expected to look like every wave of dosage rollout for the vaccine. Large at first and then slowly taper off as the weeks and months go by. What I can tell you and what parents do need to know is that if your child is between the ages of 3 and 5, they can get their shots at a pharmacy, local doctor, or the health department. If they are younger than that, they cannot go to a pharmacy to get it. I've talked with a handful of those local health departments and entities that are getting their vaccines. They say that they do have Moderna shots and they are expecting to get those Pfizer dosage today.
Have just our little corner of COVID. So
one order of Moderna vaccines sit in this pink box. 10 multi-dose vials containing 10 doses of the vaccine, carefully measured to treat children 6 months to 5 years old.
In terms of being a game changer, it's just that this is a cohort that tends to constantly hold illness.
More than 400 children in this age group have died from COVID across the country since the pandemic began.
The email says you can start today.
Dr. Becky Weiselbaum works with High Point Pediatrics and says children in this age group are still catching the virus and giving it to other family members.
Can't or don't wear masks well, and they are the ones that are in daycare, in contact with each other, and sharing everything.
The doctor plans to start administering shots later this week. Other agencies like Cone Health are still laying out their logistical plan. They have more than 700 Moderna doses, but are still waiting for Pfizer shipments.
We're just checking off all the boxes and getting everything laid out so that next week we'll be ready to go.
The Pfizer dose will be broken up into 3 shots. There will be a 3 to 8 week gap between primary dose 1 and dose 2. The third dose will be given after 8 weeks. Moderna is broken up into 2 doses with a 4 to 8 week gap between them.
Time is important for folks. Then, of course, having a 2-shot series means that the child has the full series quicker or sooner than if that 3rd shot is required.
What are the downsides for parents that are hesitant and want to wait a little bit to get their vaccine?
Certainly if you have anybody who is either immunocompromised or if you have a grandma or grandpa who are definitely at higher risk for severe breakthrough infections, that would be helpful to have those little ones be protected as well.
Some children have already had COVID, so they may already have built up some natural antibodies and have some protection. So those parents may not need to be as concerned about getting here like as soon as children who don't have any protection.
Most of the agencies that I've been able to get in touch with tell me that they plan to be appointment only for right now. If you want to find out how you can sign up and make your appointment for your child, you can go to the company's website or you can go to the state's website, which is myspot.nc.gov. Live in Winston-Salem, Daniel Pierce, Fox 8 News.